to a physical exam. Can you state your name and date of birth?
Brock Burnley, January 1st, 1990.
Okay, great. And then I'm just gonna say what supplies I have. So I have my stethoscope, my tongue depressor, an otoscope, and a reflex hammer that I'll be using during the exam to complete certain assessments. Alright, so we're gonna start with a neuro assessment. Okay, so I'm gonna have you already told me your name and date of birth. I'm gonna have you tell me, can you tell me where we are right now?
Yeah, we're in the house.
And what are we doing?
Head to toe examination.
Alright, and then can you tell me who the current president is?
Donald Trump.
Can you tell me who the last 3 presidents are?
Trump, Biden, Trump.
And then we're gonna do a short-term memory. So I'm gonna tell you 3 words now, and then you're gonna say them at the end of the neuro exam. So can you? The words are apple, carrot, and dog.
Apple, carrot, dog.
Okay. So later I'm gonna ask you those. Okay. So we're gonna start with a neurological exam. I'm gonna scooch forward closer to you. All right. So first, I also would have 2 different scents to test his cranial nerve number 1. So I'm gonna have you cover one nostril, and then you're gonna smell this scent. Tell me what it is.
Coffee.
And then go to the other nostril, and then smell this scent. Tell me what it is.
Peppermint.
All right. So looks good. And then cranial nerve number 2. I'm gonna have you. I would also have a Snellen chart to test his vision. So I'm gonna have you look over here and look at the Snellen chart, and you're gonna tell me the lowest. You're gonna read from right to left the lowest line that you can read.
RENS.
And then you're gonna read the lowest line. Oh, wait, sorry. Cover one eye, and then read the lowest line that you can read.
RENS.
And then cover your other eye, and then read from the other direction. Your lowest line you can read.
SERN.
All right. And then with both eyes, can you look and tell me for the lowest line you can read?
RENS.
Okay. And his vision looks 20/20 with the contacts that you're wearing. And then we're going to, I'm going to have you follow my finger. Okay, see my finger? Alright, 3, 4, and 6 are intact. Now I'm going to have you, for cranial nerve 5, I'm going to have you close your eyes. And you're going to tell me when you can feel me touching and if it feels the same.
Yeah.
Feel the same?
Yep, same. Yeah, same.
Alright, and then I'm going to also have you clench your jaw. Good, alright, cranial nerve 5 is intact. And cranial nerve 7, I'm going to have you puff out your cheeks. Close your eyes really tight, sure. And raise your eyebrows. You don't, yeah, looks good. You know. Sorry, you didn't have to do them all at the same time, but cranial nerve 7 looks intact. Cranial nerve 8, I'm going to have you close your eyes. And then I'm going to rub my fingers together next to your ears. You're going to point to which side you hear it on, okay?
Okay.
Good. All right. And then 9. So I do not have a sterile tongue depressor, so I'm not going to actually perform it, but this is what I would do. So first I'm going to have you stick out your tongue, wiglets from side to side, good. And then I'm going to also have you stick it out and then say ah. So stick your tongue out and say ah. Okay. And then I would stimulate your gag reflex, and that would be testing cranial nerve number 9, and then also part of 10. And then I'm going to have you raise your shoulders. Alright, cranial nerve 11, and then we already did cranial nerve 10 by seeing that his tongue was in midline. And then I'm also going to have you say those words that we just talked about a few minutes ago.
Apple, carrot, dog.
Alright, and then we're going to start on your head and face. So first I am looking at your face. I notice that you have even hair distribution. It doesn't appear to be any lesions on your face. I'm going to take a look at your head. Looks like there's even hair distribution, no lesions or lice on inspection. Do you have any pain right now? I'm going to inspect your head. I'm feeling that there's no cranial abnormalities that I can see, and there's no lesions. Hair appears to be clean and unevenly distributed, no balding. And I'm also looking at your beard. Looks like no lice in there, no lesions noted. And I'm going to feel your sinuses. Okay, so I'm gonna percuss them. Okay, and you let me know if you have any pain. Finger here. Any pain with any of those? Okay, sinuses look good. And then we're gonna take a look at your eye. I'm gonna take a seat right here, and we're going to do visual field testing. So I'm gonna have you look at me and cover one eye, and then you're gonna tell me when you can see my fingers wiggling. Okay?
Mm-hmm. No. No. No.
Good. Same thing with the other eye. Cover and wiggle. Tell me when you can feel wiggling.
No.
Let me see them wiggling.
No.
Oh yeah.
No.
Okay. Perfect. And then we're going to. I also have my pen light. Alright, so I'm going to take a look at your eyes. Okay, so you're going to look at my nose or look behind me, whatever you would like to do. Good. Good, alright. Pupils react both directly and there's also accommodation and convergence with those. Eyes appear to be equal, reactive, and round. And then we're also going to do, I know this one. I'm gonna have you look at my finger, follow my finger with your eyes. Good. There is, I said the wrong thing. So there's convergence and accommodation with that test, and then there's also direct and consensual light pupillary reflex with those. Now take a look at your ears. Is there any pain in your ears right now?
Mm-hmm.
No. Okay, first I'm gonna look. I see that there is no lesions, no redness with the mastoids or the ears. I'm gonna palpate. Any pain?
No.
Any pain?
Mm-mm.
No. Okay. I would take my otoscope with a cover on it, and I would inspect your ears on both sides. And the tympanic membrane appears to be pearly gray and translucent, and canals are clear. There's no cerumen blocking those. And any pain in your nose? I'm gonna just take a look on your nose. I see it looks like it's midline. There's no abnormalities with your nose. And I'm gonna test your patency of your nose. So I'm gonna have you cover one nostril and blow out. And same thing on the other side. Good. All right, looks painted. And then I'm gonna have you tilt your head back. I'm just gonna look in your nose. All right, looks to be nasal hair in there, and there's no dryness or strainage or swelling. And then I'll just palpate just to make sure it looks good. Any pain?
No.
All right, and your mouth, your lips look moist and have you smile. Teeth look intact and clean. Then I'm gonna have you stick out your tongue. Good, tongue looks good. Have you lift up your tongue toward the roof of your mouth. There's no lesions, no bleeding of any gums, and your tongue looks intact. And we're gonna take a look at your neck. First I'm gonna look at your neck. I don't see any lesions, swelling with your neck, no goiters noted. I'm gonna come behind you. So you're gonna scoot forward just a little bit. First I'm gonna feel your trachea, feels midline. And then I'm going to feel your thyroid. All right, your thyroid does not appear to be swollen or inflamed. And then I'm just going to palpate your lymph nodes. All right, does not appear to be any lymphadenopathy. Right, a second. have you take off your shirt, but for this exam, the patient does not want to take off their shirt. So with your shirt off, I would be examining your breathing, making sure there's no retractions, abdominal muscle use. I would make sure he's not breathing here. I would check his respiratory rate. And then I would also look for like any bruising or retractions on the back as well, or any lesions on the chest, and none of those are seen. And I'm going to I'm going to then do percussion. So I'm going to percuss on the back in the 7 spots in a ladder position going down. And there's no dullness. I'm going to percuss on the front in the ladder position. No dullness noted. I'm going to listen on the front and the back. And every time you feel my stethoscope, you're going to take a deep breath. Alright, I'm going to listen on the back. Take a deep breath. Auscultation, your breaths sound clear, there is no wheezing noted, and then we're going to do start the cardiac exam. So first I would check your blood pressure and your pulse, and those vital signs appear to be normal. I'm going to take a look at your carotids. So first I'm going to feel your carotids. Good. Present but not bounding, even. I'm going to listen to your carotids for bruits. No bruits noted on exam. And then I am going to just palpate here with the ball of my hand. No heaves or thrills or abnormalities noted in the precordium. And then I'm going to listen to your heart with both the bell and the diaphragm of the stethoscope. You can just breathe normally. And the bell. Good. And then I am going to have you lie down on the bed. I would have same thing. I would have a shirt off. I'm going to use tangential lighting. I'm looking at the precordium to make sure I don't see any abnormal pulsations or heaves, and I do not see that. And I am going to listen, but I'm going to have you kind of turn to the left side. So I'm going to put my stethoscope in the PMI, and then I'm going to have you turn to the left side. Good. Alright, good, sounds good. And there is no physiological split. Alright, so I'm already here. I'm going to do the abdominal exam. Okay, so I'm gonna have you bend your knees up. Perfect. I'm just gonna slightly move the camera. So for the abdominal exam, first off, do you have any pain in your abdomen?
No.
No, so I would uncover your abdomen, and I would look at the abdomen, make sure there's no lesions, bruising, I would look for any scarring that is present. Hair looks evenly distributed for a male, and I'm going to listen with my stethoscope. I'm listening for bowel sounds. Good, I hear your food digesting. There are all sounds present. I am going to palpate your abdomen. Okay, so first we're going to start with light palpation. And then pain with the light palpation.
Mm-mm.
Alright. gonna do deep palpation. Any pain with deep palpation? No? Okay, and we're gonna feel for your liver, so I'm just gonna kind of cup my hands and try to feel your liver. So I'm gonna have you take a deep breath. Good, okay, good. You can take it, good, breathe out. Your liver does not appear to be enlarged. And listen to some of your arteries. So I'm gonna listen to your aortic artery and your renal arteries and your iliac arteries and then femoral arteries. And those all appear to be even, no bounding noted. We're going to also do a peripheral exam, so I'm just going to check some pulses, okay? So we're going to start, I'm going to feel your radial pulses, I'm going to feel your brachial pulses, good. I will check your femoral pulses, I'm going to check your popliteal pulses, your dorsal piatus pulses. Right, they all appear to be even and equal, 2+. And when you're here, we're going to do part of the musculoskeletal exam. So first, I am going to inspect your skin in both your arms and your legs. It doesn't appear to be any lesions. Hair looks evenly distributed. Do you have any pain currently in your legs or your arms?
No.
Okay, so I'm going to have you straighten both legs. Good. And can you bend both legs up? Good. Any pain with that?
No.
Okay, I'm gonna straighten them again. And then I would palpate the joints. Any pain, palpation?
No.
Any pain and palpation?
Mm-mm.
Any pain and palpation of your ankles?
No.
No. Alright, so we're gonna do a little bit of testing. So I'm gonna have you lift your leg up to my hand. Straight, yeah. Lift your leg straight to my hand. Good. Bring your toes up. You probably can't see it. Bring your toes up, yep. And then put your hands down, your feet down on my hands. Good. Feel strong. And we're gonna have you sit up. Alright, we're gonna do some arm testing. Alright, so I'm going to have you squeeze my fingers. Squeeze, squeeze, squeeze. Strength feels good. I'm going to have you let's see. I'm gonna have you bring your arm up by your bicep, good, and then bring it down, good. Okay, bring it up, good, and then bring it down, good. Okay, perfect. And then I'm gonna have you bring your shoulders up, like out, good. Okay, pierce strong, and then we would use our reflex hammer. And we would check your reflexes on your bicep. Good. Good. And then also on your knees. So we would have your knees hanging and we would check your reflex on your knees. Good. And then we would have your knees hanging again and we would check down here. All right, good. And then I am going to have you stand up. And then I'm just gonna have you walk straight across the room just to make sure you're walking good. Okay, and walk back. Perfect. And then I'm just gonna inspect your spine. Down your spine. There doesn't appear to be any lesions or swelling. Any pain?
Mm-mm.
Alright, I'm gonna have you lean over. Oh, good. Okay, curve looks good. No uneven curveness. Alright, looks good. Do you have any questions about your exam?
Can I go back to work?
Yes, you can go back to work, and your exam appears to be all cranial nerves seem to be intact. Musculoskeletal system, you appeared strong. Your heart and your lungs sounded clear. I didn't hear any murmurs or abnormal breath sounds. Your abdomen, there is no pain on palpation, no abnormalities in your abdomen. Your eyes were 20/20. I think you're clear to go back to work.
Thank you.
Thank you, sir. I think that was pretty good.
I got to eat.
Good.